At the end of hold on period, firstly air ballasting is resorted to. Air ballasting is done which achieves two functions. One is it allows steam from the chamber which was present during the hold on period to go out. Secondly, it helps in maintaining pressure from outside so that the closure integrity is not questioned. Once you are sure that steam from the chamber is gone out, then you can have atomized water sprayed on the load, which will cool the load very effectively. And because of the air ballasting, there will be hardly any chance for any contamination to take place. However, this is not a foolproof guarantee. Even during sterilization hold, there are some pressure fluctuations where container and chamber pressure can be at opposite ends, and you will find differential applied in a different way. But however, the process has served a lot of purpose so far as LVP industry is concerned. And till the advent of new processes like superheated water spray sterilization or isothermal sterilization, this process was used almost universally for all LVP applications. This now brings us to two new additions to the terminal sterilization processes. One is superheated water spray sterilization process, and the second is isothermal sterilization process. Both these processes were essentially developed because the container changed from glass to plastic. When you change container from glass to plastic, the glass will withstand certain pressure and temperature shocks. The plastic will not. Hence, it was impossible for certain kind of containers to be processed in a conventional sterilizers. That is how these systems were developed. Now let us look closely at how these two systems work. Let us take up superheated water spray sterilizer first. As you know, when you are operating a conventional steam sterilizer, steam is your basic sterilizing medium, and steam always follows steam tables. So whatever temperature you want, there will be a certain pressure which is its natural pressure. You cannot have that steam at that temperature with any other pressure. This is where exactly plastic containers requirement is different. Because in the heat up phase, you will find that the chamber pressure of steam can go up quite fast. Container pressure takes time, so there is lag. And in the cooling phase, a reverse scenario is there. You can exhaust the chamber very fast, whereas sealed containers will not lose its pressure very fast. So pressure balance becomes one of the important points in plastic bottle processing. So coming back to the salient features of superheated water spray sterilization, first point is the pressure and temperature relationship is totally delinked. You can have any temperature and the pressure you desire. Number two is, since the heating medium is now liquid, the water remains in the liquid form even at 108, 110, 115, 120 or 125, whatever is your temperature. Water is deliberately kept in the liquid condition by increasing the system pressure so that you are heating by liquid medium. So presence of air ceases to have any meaning so far as your process is concerned. So our old problem of cold spot, air being present, air removal efficiency, all these issues are simply not relevant for these two machines. And because heating medium is liquid and it is moving with a high velocity, heat transfers are better, temperature uniformities are far better than you can ever achieve in a conventional process. And last but not the least, let us once again, either USFDA or MCA or WHO, there are a number of statutory guidelines, regulations, norms. They all now say that if you are bringing plant steam in contact with the load, have the additives within limit, or bring pure steam into contact. Or when you are cooling the load, cool it with the sterile medium, which is very expensive thing. However, superheated water spray sterilizer takes care of these two vital issues very simply by heating the circulating water indirectly. So the main machine is equipped with a heat exchanger. there is a small quantity of water filled in the machine, which could be WFI, which could be filtered TM water, that is circulated at a very high velocity, and in the heat exchanger you give plant steam and heat this water. So plant steam does not come in contact with the load. Mind you, this circulating water, when it is undergoing the process, this itself becomes sterile. So when you are cooling with the sterile medium, and all the requirements of all the latest requirements as required by various authorities are met so far as superheated water spray sterilization. Superheated is very, very essential for plastic bottles which are produced either by pump fill seal machine or by any other method. Superheated you cannot do without when you are doing either pouches or laminates. However, even in glass containers there are many advantages in case you opt for this system, because the closure integrity is guaranteed, the chamber pressure throughout the process is greater than container pressure, so there cannot be any problem. Secondly, the speed of the process can be varied very greatly. Here I would like to give you one interesting example. A multinational company approached us for a medication which was to be sterilized in glass ampoules, but only with one condition, that heat up from room temperature to 121 must happen in 4 minutes, and cooling from 121 degrees centigrade to 60 degrees centigrade once again must happen in 4 minutes, or come to 30 degrees centigrade with 8 minutes. Now with superheated water spray sterilization, we have done it not once but probably twice. So superheated, irrespective of what kind of container, what kind of packaging material looking at, is by far the best method so far as terminal sterilization is concerned. After superheated, I will briefly come to ventilator autoclave, which is equipment used for isothermal sterilization. Here also, instead of saturated steam, mixture of air and steam is used as a sterilizing medium, and the classical relationship between pressure and temperature is broken. Similarly, air removal does not mean anything to this process. However, in ventilator you have to introduce steam, so you cannot use plant steam and you have to buy additional pure steam generator. However, ventilator has one feature which none other terminal sterilization systems have, which is very, very important, where pouches are processed. Depending on composition of either PVC or laminates, there is a tendency of fogging, and defogging of these pouches is a big headache. In ventilator autoclave, the sterilization hold phase can be immediately followed by a drying phase, where heating medium, which is mixture of air and steam is allowed to go out, and you dry with the help of hot air at specific temperature for a specific time, and your fogging probably will be taken care of. It will go by itself. Like superheated, even ventilator also can be used for any application in terminal sterilization, and is only next to superheated in terms of its utility, in terms of accuracy, and in terms of performance.
Very good presentation, but we are running short of time now.
Just give me 2 minutes. I think I wanted to touch subject of F0, probably I will not touch it now. However, what I have told you is what has been happening and what has happened. When you look at development of new packaging materials, when you look at inventing of new molecules, and when you look at intense pressure from regulating authorities, excuse me sir, which is bound to increase not only in India, everywhere. This automatically means that equipment manufacturers have to double up their efforts to make sure that all these demands in future are taken care of, so that pharma industry in India can forge ahead with its real might. Thank you, sir.
That's an excellent presentation going into
details with respect to the developments that have already come in. The terminal sterilization. It's very unfortunate that we have to cut short the presentation because of the time constraint. Otherwise, it would have been an ideal topic for more than 2.5 hour presentation with a lot of interaction. Even for interaction, I can accept 1 or 2 questions if there are any specific questions.
Your question is function of air in ventilate autoclave. The function of air in ventilate autoclave is such that the proportion of air is decided by what pressure table you feed for matching temperatures to follow. Just to clear my idea, for a given temperature, if you are sterilizing a particular product at say 118 degrees centigrade, now if your product is a blood bag, now blood bag will have a volume of say 300 ml, but the solution inside will be only 30 or 40 ml. At such times, there is a tendency that 2 flaps of your bag can stick to each other if chamber pressure is greater than the container pressure. So at that time, you go on changing the proportion of air so that you can have different pressures in different stages of the process, which is necessary for that particular kind of load. This was only one example I gave, but there are a variety of such applications where different mixtures, even in one process, you use different mixtures. That is the one.
Still, I have a small query on leak testing. Are there any regulatory requirements on the amount of vacuum or the time to be for vacuum leak testing? And is there any requirement for any application for leak testing of files or glass bottles? These are two different questions.
See, your first question is, are there any specific guidelines so far as vacuum or timing used in leak testing? To the best of my knowledge, there are no such regulations. However, depending on everybody's production process, people have come to a specific timing and degree of vacuum, and they have validated themselves. But to the best of my knowledge, no authority has today given a limit that you must carry out leak test at so and so.
Thank you very much. No more questions, please, because I think Mr. Kotwal will be there over the drinks, and I think take the opportunity to ask more questions there. We have to stop, unfortunately, at this point. I'd like to hand over once again.
Yeah, that's an excellent presentation and an eye-opener for quite many people about what is coming in for the terminal sterilization. And I hope the industry takes the advantage of the caliber of the machine manufacturers we have with us and try to improvise our existing facilities to meet the world demands or world requirements. I would once again like to thank the speaker for his excellent presentation, the depth of knowledge he has on the subject. Thank you.
No problem. Thank you. Thank you very much. Okay. Dr. Banerjee, may I ask you to come over and present this to Dr. Venkateshwar. Well, we are inching towards the cocktail. This is the last session now, and I'm sure we are getting thirstier and thirstier. May I request Dr. Mukhopadhyay to come onto the stage? He is the chairman of our last session. Dr. Mukhopadhyay is PhD in organic chemistry from the University of Pune. And he has worked with very renowned scientists both in Pune as well as in Switzerland and in Brooklyn, USA, and in also, of course, he is a lecturer, associate divisional medical chemist at CDRI from Cisco. And Dr. Mukhopadhyay is in the Head Research Center as a group leader and is continuing till date. His present position is Vice President Natural Product, Deputy Head of Research, Head of Department Natural Products, Quest Institute of Life Sciences. That's very interesting. He has more than 27 publications to his credit and 14 patents. His interest is in natural product research, combining chemical and biological sciences, biotechnology, development of botanicals, research management, and of course, writing on scientific issues affecting pharmaceutical R&D. We couldn't have got a better qualified person to chair the session. Next session, which is a very exciting subject, I will leave that to Dr. Mukhopadhyay to introduce that subject. May I request you, sir?
Good evening, everybody. At the outset, I must thank Mr. Kwan for the kind introduction and Pharma Business and Technology, Mr. Brahma, who gave the invitation to chair the session. I think we have been running short of time. I tried to keep my introduction very short, but what I really felt very pertinent to point out that we are, Mr. Kwan started this session's introduction saying that we are inching towards cocktails, which is a biotechnology related product. So that's, I think, it comes very close. Biotechnology is something which is very well known. It's part of food technology, has been really from the beginning. It had not got imagination of people, that was because it was part of everyday business. But first, as we went into antibiotics, getting into big fermentation processes, and now as we start tinkering with DNA molecules, trying, if I may say, trying to play God, as we call it, it has got on public imagination. Now, this is particularly relevant in the Indian circumstances because what we feel is, as a nation, we had missed the industrial revolution that took place, which put many of the Western countries on the stage that they are. And now we are in a situation where we did not necessarily follow the footsteps of the developed nations, but try to leapfrog and catch them up by going into the sunrise industry. And we are doing pretty well in space sciences, telecommunication, and biotechnology is one of these areas, which is the sunrise industry for the future. And so it's very important, and I think as the topic is, what's the challenges in the future, I think that's absolutely relevant. The only problem in biotechnology is there are a lot of hopes, but there are not too many results. That's something which is commercially successful. The difficulty that comes in, it's extremely high risk area. There's a lot of high technology with a lot of import contents. And it's a difficult area for developing countries, whether one is able to take that risk. In our country, it's mostly that is happening is trying to get a product which is already established, not going into new or breakthrough technologies or products. So I think at this point, introducing the subject, I think it is, I leave the rest to Dr. Subita Srimal to speak and elaborate what is the status of investment. Is this really investments that are necessary are coming into the industry? She is part of this industry, so really competent to talk on this subject than me. She has done her PhD from Calcutta in IICB in biotechnology area. Subsequent to that, she has been always been traveling as a postdoctoral fellow for business in Japan, New York, US. In India, several of the important institutes also. She has a very wide exposure to this subject and personal experience. She has put a lot of efforts in bringing some technologies from the lab scale to pilot print production. That's the industry, that aspect would surely come in. She's involved in commercial launching single-handedly through great efforts and have been in constant touch with the scientific research also, apart from industry in this particular area. She's the director of Monukitsi Biogens Bangalore And I think I leave the stage for her to speak and really elaborate on the topic. Thank you.
It may seem unfair, ma'am, but I have to request you to try and finish it by 7:15, because we have to get out of this place at 7:15. I'm sorry, but this seems unfair, but unfortunately we were running behind schedules and he was making very interesting presentations and taking a little bit longer to understand it.
Thank you for the nice introduction, and I thank the organizers for inviting me to this forum, which is absolutely new to me. I'm used to speaking to scientists on a general topic, but this is a topic which I have taken as a challenge, and introduce it to the pharma industry. Now, I represent a company called Manukirti Biogens Private Limited. This is located in Bangalore and is a small company supported by a small but focused, dedicated group of researchers. And one of the main reasons why this company was formed is that because we all strongly believe that we have a lot of indigenous technologies as well as indigenous talent lying idle, and yet we are so dependent on imports. So we aim to boost indigenous technologies and manufacture reagents which are currently imported. This is one big thrust of our company. At the same time, since we all are talented, we all have experience both abroad as well as in India in basic research, I think we have the talent to explore natural resources for novel compounds with novel functions and applications. Now, people ask me, why do you call your company Manukirti Biogens? Now, what I believe, Manukirti Biogens, I come from a family which has a long history of diamonds and other precious stones. But when I learned biology, I realized that biology and nature has much more to offer than what diamonds can. And what I call refined biogens is listed in the topic above. Now, these can include enzymes, diagnostic reagents, specific proteins or molecules, or even microorganisms with unique properties, as well as other things. One of these things which we have developed is from a basic material which is available in plenty in India, and the resource was always known but never discovered or brought to the commercial production. I will just give one example of this, and that is our product, the first product, which is Carcinoscorpius amebocyte lysate, which is very well known to the pharma industry as the LAL reagent. This is the first product launched by us and is an import substitute for the LAL test. LAL test is actually technically known as the bacterial endotoxin test, and the history of this horseshoe crab amebocyte lysate dates much early. I'm just going through the chronological order simply because what is always obvious to most of us is that in school days I was taught more of British history than Indian history. I knew more about Mary Queen of Scots and Queen Elizabeth than Rani Jhansi or the Indian Revolution. In a similar fashion, what nobody realized is that the Indian horseshoe crab is also abundant in the Indian coast, and it has been well documented. Yet if you look up a textbook, zoology textbook, and ask for a living fossil, the example is always Limulus, which is the American species of the horseshoe crab. For your general information, there are only 3 genus of the horseshoe crab present all over the world, and 2 of them are abundantly present in the Bay of Bengal area. Now, this was well documented as early as 1902. Then, while in 1965 to 68, when the LAL test was discovered and was being approved by the FDA, simultaneously in 1977 and early 80s, we in Calcutta also did a lot of research on the Carcinoscorpius amebocyte lysate and developed a product of equivalent quality to LAL. We approached the industry when I was doing my PhD. However, the industry did not show much interest, mainly because it was still not approved by the FDA and nobody was still using it in the West as largely as possible. This is the story of many other products which are lying unproduced in India simply because it has not yet caught up the West. And the reason I brought up this topic is just that our product, CAL, was the first product to be launched in India, and the whole technology existed for almost 10 years. However, it is only now with our efforts that our company was formed in 1990s, 94, 95, that we have now brought this product from the pilot scale to the commercial stage, and now we hope to do this for many other products. Now this is just an example of what is are we really ready for biotechnology in India in terms of large investments? Before I go to that topic, let me just give you a topic that even now when we ask people to buy LAL or CAL, people ask us what's the difference between the two. And the next slide shows that. Okay, this is just a slide which we had presented to all the industries in 1980s, telling them the implication of the results, telling them how useful the reagent would be. However, there were no takers at that time who would do. There were small, hard-hearted efforts from the industry, but nobody really grasped the implication of this product. Next. Now, people ask me, how is LAL different from CAL? Now, it's as different as if you see the difference between A and B. This is just A represents a blood from an American and B represents blood from an Indian. If anybody can visually tell me what's the difference between the two blood, I won't say anything. Except for genetic differences, I don't see there is physiologically much difference between the two blood. In a similar fashion, the three species of the horseshoe crab, Carcinoscorpius, Limulus and Tachypleus, are just very similar and represent very similar biochemical events. So as far as the CAL, LAL or TAL, the name of the three reagents which are used in the bacterial endotoxin test, is concerned, biochemically there is no difference between the three species and all can be interchangeably used. Next please. I'll just skip this slide, but this is just all the research work that has been done to establish the biochemical similarities between the three lysates of the horseshoe crabs. Okay, this is just the implication of what the market size of this reagent is. India at present is importing worth 10 to 15 crores worth of LAL reagent to cater to the needs of all the pharma industries. Now this is just a classic definition of biotechnology. It is the application of technology principles to living systems. Now, next please. Now we are now in a new century, where the century of physics is yielding to the century of biotechnology. The brave new world may turn out to be a reality. With the mapping of the human genome being completed, soon we will have a better understanding of human diseases, and there will be a flood of information. In this great manthan, we should also, I think, it's time all very important for all of us to turn on our creative genes and maybe get some amrit out of this. Otherwise, let Lakshman have the last laugh and say that lucky we haven't progressed. Otherwise, besides malaria, cholera, jaundice, etc., we would still have to fight. We would have had to fight Y2K. Now, biotechnology by definition has changed largely, as Dr. Mukhopadhyay just said. Yesterday's technology was being practiced at home. Our grandmothers did it. They made curds, cheese, they made wine, alcohol, etc. Now today's technology means everybody wants pure enzymes, recombinant proteins, growth factors, which are all in the market and are minting a lot of money. However, the risk factor is very high in developing biotechnology products. There's no doubt about that. All venture capitalists will tell you that. However, they are also all willing to sponsor biotechnology products because they believe there is a lot of hope in it. And that is because in the next century to come, or the next millennium, DNA chips, edible vaccines, gene therapy are not going to be, are not far off. Now, how is it that India has lagged behind this? In the 80s, USA witnessed a biotechnology boom. The investors funded ideas, concepts that would lead to a product. This venture today has yielded several products. While the Indian industry has always played it safe, only established technologies were bought and products made in India. Investment in concepts or basic findings were not there. I'm just catering right now to the biotechnology sector. Research and development sectors in the industry were mostly for duty-free imports or tax-saving purposes. This has to change. Just as we are fighting our dowry system, I think this alliance, where only what is imported or what is from the West is good, has to stop. This is just a comparison of what I think should not take place in the near future in the sector of biotechnology. Next. Now, necessity is the mother of invention. Today there is a sea of change both within the industry and research organizations. I have the advantage of being representing both the industry as well as spent almost 15 years of basic research. Therefore, I know what the pains and the problems of a scientist are, and now I'm seeing the problems of an industry too. Now, everybody has realized, especially in the biotech sector, that there is a very thin line dividing basic and applied research. Moreover, the government is also asking the scientists to look beyond publications and promotions. Now, scientists are supposed to be endorsed with a lot of patience, and out of 10 years, 10 hours of working and 100 hours of frustration, when they still get a result, they get very excited and are very pleased. However, one quality they've always been lacking is perspective, and that has been endured to the industry. Now, I feel if both of them join hands today, there should be products and there should be patents. Question is, will they meet? Now, biotechnology today is very different from yesterday's simple ways. It is demanding both in sophisticated instrumentations, techniques, investments in time and money. As stated, for recombinant proteins, expression is a lot of perspiration and very little inspiration. Today, the mood in both the industry as well as the academics is upbeat. Both are willing to take risks and both are willing to change. So the scientist has been told not to be just an astrologer who predicts what will happen, but make it his moral duty to see that it happens. While the Indian industry is in a mad rush to discover drugs, buy ideas and develop a core strong research team. Today's situation, besides the mood changing between the industry as well as the scientists, I think there's a surge of small-scale biotech industries promoted by scientists who have dared to start business in a small but sure way with a strong conviction to achieve and win. At the same time, there is discontent among researchers in the R&D of industry. And the main reason, quote, lack of incentives other than the financial variety. They yearn for decisive leadership, a sense of making a difference, and some fun and flexibility. Listed are some Indian biotech companies promoted to meet indigenous demands. These are not very high-powered or very profitable companies yet, but it is a small step towards the future. The names are listed, and many of them, at least 3 or 4 of them, have been promoted by scientists and are small-scale industries. Now, what do we have to offer? The options which I propose is listed below. One is the industry can capture ideas, concepts in their infancy through rediscovering, reading results that are gathering dust. Just as my PhD thesis would have remained lying in the Calcutta University, I don't know how many more pieces, how many more results are still lying, and just it needs a little more interest both in the industry's part as well as the researcher's part to tackle them again and see if something can come out. Something has been lost, whether it can be rediscovered. Then interacting with academics on an equal footing, with an equally competent team. I stress on this word competent, equality, because what happens in most of these alliances between industry and academics is the chief of the R&D and the head of the department of a unit meet and they discuss and the matter is closed or started. The two people who are actually doing the work, who share the pains, the failures and the success, never share data in full honesty. I think that is very, very important for the success of a project. And the research environment also will come up both in the industry as well as a focus. The scientists will be forced to become more focused. There are different strategies for this. One is sponsor PhD projects in universities, which impart so much knowledge to the future, yet are very poor in funds and facilities to carry out research. When I was in Japan, I was surprised that more than 50% of the PhD students over there were being sponsored by industry. After the PhD, they would all go back to the industry, so they had very focused plans and they knew that they would have a job waiting for them after a PhD. If there are promising results from a thesis, then please nurture it further or absorb the student. This will curtail exports of a PhDs and raise the hope in youth that there is future and jobs waiting after a PhD. The second very important point which I want to build is build a stronger legal internal department with a good understanding of biotechnology so that patents can be filed well in advance and also challenged. I don't know if any of us are really very clear about the rules writing a patent in biotechnology. Because molecular biology can make new out of anything old, and the trick lies in modifying and creating. Thus, products that are still in the market, can still be made and sold with a different garb and design. It needs a little bit of more imagination, and then finally how the patent lawyer frames the patent. Another strong point for biotechnology products is development of the quality of clinical trials in India. This has to improve to attain international standards. And since my husband is a doctor, I know the other side of the coin, and I feel that doctors should be unbiased and honest in their results. They are given too many liberties and too many temptations, which I think should stop, because there is no choice in being honest and sincere in science or anywhere in life. However, if the industry still wants to play it safe, then it can be tried out in different phases. One should take advantage of growing entrepreneurship in the scientific community. These entrepreneurs and consultants can test the feasibility, assess the results, and may bring the product to the pilot scale. Let the upscaling and the commercial production be done by the large scale industries. In the US itself, the large biotech industries are all nursed by small two-man or three-man small biotech industries. These small-scale entrepreneurs can act as a bridge so that the industry is spared of the absent-minded professor and the academicians are saved from Shakespeare's Shylock. I think there can be a non-stop discussion on the issue, but I think that it is now our moral responsibility to make things happen. We should pledge on diseases, problems facing India, because I think those are not relevant to the West. And we can have a strong point on that and find solutions to them with our own resources. Let us stop aping the West blindly and stop doing fashionable science. Dolly, leptin, Viagra are all the joy of the West. They are not our current problems, and we should try to tackle problems which we have. In this era of biotechnology, we have to choose whether we want to stand on our feet or always lean on the West. And my concluding statement is, I think with the challenge in biotechnology is obvious, and we have to decide whether we are going to take the bull by its horn or be satisfied with doing this contract research and enslave ourselves forever. With our scientific manpower, traditional knowledge and wealth and history of overcoming pressures without losing our identity, I think let us come out as winners, like this ancient fossil, the horseshoe crab, which is shown in the next slide. Thank you.
moment we are running short of time, so we will not be able to allow any question and answer session at this point of time. But please use the cocktail and follow-up discussions during the time any other questions and things we have. I think she has presented excellently how the things have to come in future. We have passed through the era of reverse engineering. This is the things that are happening in biotechnology can be called as maybe re-engineering of the same things. What we are trying, what she is trying, and I think I strongly support that, is to create a new foundation for a new future. I think we all, industry, academic, everybody has to come together to build future. I think we have to conclude the session and let it over.
Yeah, thank you very much. Super job, very well. Ladies and gentlemen, you have been spared my wrap of comments because there is no time. So I'm not going to say anything except to say thank you very much indeed for being here and for being here despite missing the last tea break. We're going to have the cocktails and the dinner at the poolside. If you are not familiar with it, you will have to go via the driveway and enter the poolside on the left side. At the cocktail dinner time, we would also be making, for the first time, Pharma Business and Technology Excellence Awards. And I would urge you to be there, and I will leave it to Brahma now if he wants to add any closing remarks here.
Thanks for everybody to be here, and thanks to all distinguished personalities having spared full days of time despite hectic engagements. Thank you all. Now I invite you to join with us for cocktails and dinner. Thank you.
of what God had condoned on the seagulls, he flew high, soared into new realms, and then crashed down to earth to experience the thrill of falling at around 500 miles an hour. He flew in the night. From being just an ordinary seagull, he became something special. His goals became more spiritual, visionary, of foresight, and then he was able to pass on the mantle to another person, another gull, who shared his vision. Well, today, thanks to the Pharma business and technology, we are here together to applaud, to reward, and to recognize some of the few seagulls of the pharma industry. Those people who, with their entrepreneurial skills, their leadership, and with their true vision, have been able to bring the pharma industry into a new world, give it a new dimension, and make it a force to reckon with, putting them on the global map. We are here for the Excellence Awards in Entrepreneurial Skills instituted by the Pharma Business and Technology. Before I proceed further, I would like to invite on the dais our chief guest for the evening, who would be handing over the awards to these successful entrepreneurs. Ladies and gentlemen, please welcome Dr. J.N. Banerjee. Dr. Jayantnath Banerjee was born in Bengal, educated in Allahabad, Bombay, Lahore, Banaras and Nottingham. Good evening, sir. Dr. Banerjee joined Sandoz in Switzerland in 1954. After returning to India, he rapidly rose to become the managing director of the company of all the three divisions: pharmaceuticals, agrochemicals and dye chemicals. He was also the chairman of Wonder. He was elected the president Commonwealth Pharmaceutical Association in London for 5 years. During his tenure, he visited almost all the countries in the Commonwealth. He was an advisor to the Commonwealth Secretariat and WHO projects involving health and delivery systems. In India, he has been involved with the Ramakrishna Mission and its hospital. He is the chairman, Bombay College of Pharmacy, president of the Indian Pharmaceutical Association, and a trustee at the Nehru Center. Please join me in welcoming Dr. Jayantnath Banerjee. I would also invite Mr. Devendra Pal, Mr. Ajit Singh, and Mr. S.N. Brahma to please come on the dais. This year, ladies and gentlemen, the first year of these awards being instituted. It is a beginning, and the Pharma Business and Technology Group assures you that there will be no end. Every year, there will be this impetus, this boost for people who can excel, people with vision, to bring forth their entrepreneurial skills, and surely they will be lauded and rewarded. Today, we have 3 Excellence Awards. We have not followed any order. It is just those 3 names which stare us right in our face when we talk about outstanding contribution to the pharmaceutical industry in the last century. Because the century is already past, we are into the new millennium. I would request Mr. Devendra Pal to now take over and announce the first award.
This slide is very enlightening. When we became independent in 1947, I think we were zero in the pharmaceutical industry. And from that zero position, we have become heroes of the pharmaceutical industry. The whole world virtually envies us. And a lot of pressure on IPR is partly as a result of developments that have taken place in India. Not that it is wrong to have that IPR in the country, but I'm talking of the pressure which is US and other countries have been putting, has been as a result of a tremendous work that has been done. There have been so many people who have done a marathon work in human service to the pharmaceutical industry, but we are today honoring the 3 heroes who helped pharmaceutical industry in India really made into a hero. And we are, as Anand said, announcing these awards in alphabetical order. The first one is none other than Mr. Deshbandhu Gupta. Please welcome him on the dais.
Shri Deshbandhu Gupta, chairman and founder of the Lupin Group of Companies, is one of the most distinguished and respected entrepreneurs of the Indian pharmaceutical industry. His dream to fight life-threatening infectious diseases and manufacturing drugs of the highest national priority led to the formation of Lupin Laboratories Limited 31 years ago. This dream has become a reality today. Shri Deshbandhu Gupta's dedicated commitment led Lupin to achieve the distinction of becoming India's third largest pharmaceutical major with a group turnover of rupees 1,000 crore and with a commanding position in the anti-tuberculosis and cephalosporin antibiotic segments. An academician by background, Shri Deshbandhu Gupta, with a master's degree in chemistry, started his career as a professor of chemistry at the Birla Institute of Science and Technology, Pilani, Rajasthan. Shri Deshbandhu Gupta's entrepreneurial spirit, backed by scientific temperament, has borne fruits today. India leads the world in manufacturing anti-TB drugs, notably ethambutol and also rifampicin. This is one of his most important contributions to this country. Despite all the efforts of medical profession, Government of India, World Bank, other aid agencies and the pharma industry, TB still remains a major killer disease in India and in many parts of the world. Lupin has now emerged as a leading company to enter the markets of USA and Europe with its sophisticated cephalosporins range. Beyond the realms of business, Shri Deshbandhu Gupta's contribution to rural development is well known. Shri Deshbandhu Gupta's heartfelt commitment to improve the socio-economic status of rural India has resulted in the successful initiation of grassroots level integrated rural development program to benefit the less advantaged sections of the society. In this regard, the Lupin Human Welfare and Research Foundation has won accolades from the UN as well as the central and state governments, including an award from the Prime Minister for its revolutionary work in transforming the lives of villagers in the backward rural areas of Rajasthan and Madhya Pradesh. Mr. Gupta says, "This is my laboratory of 500,000 people, and I have great enthusiasm to help it to expand to other parts of the country. Philosophically, I am driven by the ethos of Indian culture, of paying back my gratitude to the society." Shri Deshbandhu Gupta's pledge to eradicate tuberculosis has taken roots in setting up of the Life for Life Foundation, an independent, non-profit organization that is committed to the task of creating awareness and educating people about the dangers of tuberculosis and eradicating it through scientific medication. Shri Deshbandhu Gupta is on the governing board of the Pharma Pulse and is also on the apex body for industrial development of Rajasthan state. The noteworthy achievements of Shri Deshbandhu Gupta can be attributed to his being both spiritual in vision and scientific in temperament, and a firm believer in the science of Vipassana meditation. Shri Deshbandhu Gupta is a trustee of the Global Vipassana Foundation and is also the chairman of the ISKCON Juhu Temple. Pharma Business and Technology are privileged to confer the Pharma Excellence Entrepreneur Award on Shri Deshbandhu Gupta.
Might be getting into your hands. Yeah.
The next award.
Well, we know many doctors who are in search of patients, but we know only one doctor who is in search of patents, and that is none other than Dr. Anji Reddy. Please welcome him.
Research and development in the pharmaceutical industry is of paramount importance, and the fundamentals of basic research reflected deep in the eyes of the man whose initiative to lift and accelerate this is seen, felt, and realized in no better individual than Dr. K. Anji Reddy, chairman of Dr. Reddy's Group of Companies. A BSc Tech in pharmaceutical science from Bombay University and a PhD from the National Chemical Laboratory, Pune, Dr. Ranji Reddy had 6 years' experience in IDPL in the manufacture and implementation of new technologies and bulk drugs. After leaving IDPL in 1973, he started Uniloids before starting his own group of companies. In 1984, he set up Dr. Reddy's Laboratories Limited and the Cheminor Drugs Limited. Starting with a modest turnover in 1985, the group today is one of the top 10 pharmaceutical companies in India. Dr. Reddy's Research Foundation, DRF, established in 1993, the research arm of Dr. Reddy's group, is the first organization in Indian pharmaceutical industry to take up basic research. Since its inception, DRF has filed 35 patents in US, out of which 23 have been filed with the PCI for its discoveries in cancer, diabetes, ulcer, and bacterial infections. These achievements of Dr. Reddy and his group have been recognized by the government. Dr. Reddy has been a member of the Drug Technical Advisory Board and the Pharmaceutical Council of India. He has also served as chairman of Andhra Pradesh Industrial Development Corporation, that is the APIDC. Dr. Reddy has been the president of Indian Pharmaceutical Congress Association 1992. Dr. Reddy is a member of the Board of Trade. He is the chairman of Academy of Human Resource Development and the chairman of FICCI R&D Committee. Dr. Reddy was recently nominated as a member of Task Force on Pharmaceuticals and Knowledge-Based Industries by the Prime Minister himself. Dr. Reddy has received several awards. Some of the notable awards are twice Sir P.C. Ray Award by Indian Chemical Manufacturers Association for Development of Indigenous Technology in the years 1984 and 1992. Indian Chemical Manufacturers Association Export Award 1986. Manager of the Year 1987 by Hyderabad Management Association. Professor Nayudamanna Memorial Gold Medal Award for being the Outstanding Technologist of Andhra Pradesh for the year 1989. Lifetime Achievement Award for Research and Industry confirmed by the ANACON, Indian Analytical Instrument Association, for the year 1997. The FAPA Ishidate Award given to an outstanding Asian pharmacist excelling in pharmaceutical research by the Federation of Asian Pharmaceutical Association, the FAPA, in the year 1998. Pharma Business and Technology, privileged to confer the Pharma Excellence Entrepreneur Award to Dr. K. Ranji Reddy.
I have the great pleasure now to mention the name of a revered and a very inspiring leader and a friend of everybody, Dr. Parvinder Singh. Dr. Parvinder Singh was a visionary. He was one of those few persons who saw tomorrow well before many others saw in this country, and I think he achieved something which many would like to emulate. Dr. Parvinder Singh is no more with us, and we have the pleasure of presenting to him an award posthumously, a Lifetime Achievement Award. May I request Dr. Khanna to come on the dais and receive the award on behalf of Dr. Parvinder Singh posthumously.
Dr. Parvinder Singh, Pammi, as many of the industry called him affectionately, passed away prematurely on 3rd July 1999. He was not only an inspiration to many in this industry, he was a person admired as a wonderful human being and loved for his many sterling qualities. He had humility and gentleness, but he was firm and determined. He had vision and great intellect, combined with a remarkable gift of being able to articulate it with clarity and conviction. There is so much one can say about the man, and yet there is little need, as he was a good friend, an inspiring leader to many in the industry. Dr. Parvinder Singh was probably the best ambassador this country could ever have produced for the new emerging India and the new emerging Indian pharmaceutical industry. As an entrepreneur,